Parkinson's is a very complex disease, right? One of my mentors said if you've seen 100 Parkinson's patients, you've seen 100 Parkinson's patients, and they're all unique. But from what we do know about Parkinson's is that there is a loss of dopamine producing cells in the basal ganglia, a part of the brain. And so what happens is as these cells die, these dopamine levels decrease, and that's when we start to see the characteristic symptoms of Parkinson's.
I can identify some symptoms or whatever, and that's good and bad, because it's good as you recognize it, but it's bad because you hope that it doesn't happen to you. But it is inevitable. There's no cure for it, but you can slow it down.
They thought just some muscle thing, but I kind of started dragging my foot a little bit, and then I noticed some tremor. So through 2 different doctors, I ended up with Dr. Walter in the Cleveland Clinic Network, and he diagnosed us at Parkinson's and confirmed it. And just learning that exercise is part of the script. You have to exercise, and that's just so important.
I think when you have a chronic illness like this, you need to do something with what you have to improve science so that other people can benefit from what they've learned through their research programs.
We've had very positive data coming out of the lab from a short-term perspective, 10, 12-week type studies. So we need to create interventions that are sustainable and long-term. And so this was our goal, was to take this laboratory-based intervention and drop it into the YMCAs and really evaluate individuals.
Participants go through the Cleveland Clinic, they do their baseline assessment, and they start off 3 days a week, 45-minute classes for 12 months.
I'm the only one in the class that hasn't missed a day, and it's like, can't miss a day, and I'm sure I will. I didn't come here with the goal of not missing, but I came here with the goal of doing the best I can.
I was pretty athletic all my life, but just through life and aging a little bit, probably 3 times a week, but really wouldn't push myself. So I think through this class, I've pushed it. You have camaraderie, you have a watch, you're watching things, the data on the computer, you can log into Garmin Connect and really push yourself because you're seeing the data.
It's a really good workout, but it's the point now where I feel like I've done something, which is a good feeling.
Parkinson's disease really is an isolating disease, right? People start to have a tremor or other postural instability, and what happens is they don't want to go out for dinner anymore, right? They don't want to go collaborate or go play cards or whatever with their friends, so it becomes very isolating, and this is a way to reduce that isolation.
Before you come through the door, as soon as you come through the door, you're communicating with those people that are participating with you. That's important, because most of us, like myself, I don't talk to anyone until I get here.
It's just lifted me up emotionally just to have the support of others. I feel like there's friendships that are developing, there's new people, you kind of gather around the new people and kind of help them start, because the different people are starting at different weeks as they enter the program for a year.
So in fact, exercise really is medicine. And we would never give someone a bottle of pills and say, take them as you wish, right? And I think we have to do the same with exercise.
By being a part of things like this study that is really looking at, okay, fitness is now an extension of healthcare even, because we can control symptoms of diabetes and high blood pressure, depression, anxiety, and even now Parkinson's disease. So for me, as someone who works in this field, the opportunity to be a part of that bigger picture of how we're looking at wellness and the role that it plays, it's really something that I'm honored and grateful to be a part of.
My goal would be that the study is positive and shows that a community-based approach to high-intensity exercise actually is effective in slowing the progression of Parkinson's disease, and give opportunities for individuals with Parkinson's to go to a YMCA or community center and exercise as part of a community.
I feel better, and I feel good. I really feel good.